So today I'm going to talk about I guess the backlash more of anything regarding hysterectomies. Because, when you get to a certain age, it may be something that you're going to be foreseeing, right? Or something that you're going to have to go through. But at 28, it's a little different, right? Because you're still at your prime. So it was a big decision for my daughter, but it was something that there was just no other option. And what I'm going to really be discussing is how it's changed her life right now, and not only for the good, but also all the bad things that she's dealing with right now, health related. So we're trying to figure out or determine whether it's that or it's her PTH surgery that she recently had. So I'm going to bring you into my world, give you a little bit of insight of what we're dealing with, something that I'm actually facing at this point of what I'm going to be doing in the next few weeks. And hopefully you get some information or some good information out of this, and to help you make your decision if this is something that you're facing in the near future. So hello, if you are new to my channel, welcome back if you are a seasoned subscriber. On Mondays I do videos all about fashion, accessories, stuff that I enjoy doing to keep my mind off or busy, and kind of keep my head, keep my head in the game. When it comes to the second half of my videos, or on videos that I upload on Fridays, they're all about medical emergencies that we've had to deal with in relation to TSC, which is tuberous sclerosis complex, and FSGS, which is a form of a kidney disease that each of my daughters have or are currently battling. So if you're interested in either or, please hit the subscribe button and hit the little bell so you can be notified on all of my latest videos. And please don't forget to hit the like button as well as comment below so that you can help me with the algorithm gods and continue to help me grow my channel. And I hope everyone is having an amazing day. Here in Florida, we are currently facing a incoming hurricane, so we are bracing ourselves. So I was trying to get this video in before the hurricane hit us, so before we lose power. So let's get started. So recently, about 3 or 4 weeks ago, my eldest daughter, obviously, recently got a hysterectomy done. What was happening was, after her kidney transplant, she hadn't had her period. Excuse me for those of you guys, sensitive information, but she wasn't regular for quite some time. Once she got her kidney transplant, she ended up bleeding excessively to a point where she was not able to do anything day to day. It was so excessive, it actually was causing her hemoglobin to actually go down, which will eventually impact her kidney transplant. So we tried to do a couple of things. First, she tried to do the DNC. So the DNC worked for about maybe 6 weeks. And then obviously she was on different medications trying to subside the bleeding, but it would just come back rapidly. Now, one of the medications that she tried, the tranexamic acid. So she did try it. It helped her out a little bit. She also tried birth control, but each of those are detrimental to kidney functionality. So we have to be very cautious. The birth control worked a little bit, but then she started bleeding again. So the tranexamic acid was probably the best medication that really helped her, but eventually that does cause long-term kidney damage. So unfortunately, she couldn't be on that too long either. So she did try she did do the DNC, she did have the birth control, she did try the tranexamic acid. So neither of those worked long-term. So that being said, obviously the next choice was hysterectomy. Now, with the hysterectomy, she did have a lot of stomach cramping, which is actually more like pelvic pain. She then identified or found out that she had, unfortunately, she had blood clots. So those blood clots, obviously, if you are aware, can be dangerous. But from what the doctor was saying, those aren't as dangerous because those are absorbed where they were located due to the surgery. He said those were obviously going to be absorbed by the bloodstream, which is fortunate for us. Unfortunately for her, though, it was yet another thing that she's dealing with, right? A lot of pain there. We had just recently had her go in to have a parathyroid surgery a couple of months prior, and during that process, the nurse actually hit one of her nerves while trying to put in her IV, and that caused severe pain. She had severe nerve damage, so she was still recovering from that. Then going in to do the hysterectomy, causing her to have severe pelvic pain. So she was kind of dealing with both at the same time. You know, the best case scenario was the therapy did help her with the nerve damage, but she still has some backlash from that, her thumb. So she's still trying to recover from all these different issues. Now the hysterectomy did help her. She no longer is bleeding. She still does have her eggs, so we were good with that. Right now, though, she is still having some issues where she's having stomach pains, severe headaches. She does have really bad panic attacks, always because most reasons why, or mostly because of the unfortunate circumstances of anytime she feels something's wrong or off, she panics. Her, you know, just having to deal with the assumption that, you know, she could lose her kidney after all these years of being on dialysis and getting, you know, fighting to get on the kidney list. This is definitely going to be dramatic, right? So those are things that she's currently dealing with, but we're trying to find out what's causing her to have the stomach cramps and the headaches. A lot of it, obviously, she did recently get her checkups back in her doctor. She went to see her surgeons, everybody, for her 6-month checkup. Everything looks good with her kidney, so they know it's not her kidney. So right now she's got to get her parathyroid checked. Also they want to check to make sure there's no issues with her with the hysterectomy that she had. Now with the parathyroid, as you're well, you know, it really is something that controls pretty much all of your systems, how you feel. So when she's out in the weather, the cold weather, she's hot. But when she's out in the hot weather, she's boiling hot. So she is literally outside with shorts and a t-shirt during like 50 degrees weather because she's so hot, you know. So that's something that we obviously got to keep track of. So but as for me, right now I'm in that kind of weird little weird little session where I'm trying to determine what's the right course of action here. I did try a DNC because I do have fibroids. So obviously, as you get older, you do deal with these certain situations where is hysterectomy the right choice for me? I am trying to steer away from the hysterectomy, especially because I know all the backlash and stuff. Not really the backlash, but all of the issues that come about with having a hysterectomy, extreme tiredness, just all the craziness as far as like inability to sleep, the discomfort, the headaches. Pretty much, it's such a long list of issues that you can have. Bleeding, discharging, constipation, all the menopause symptoms that come with it, especially if you remove your ovaries. Pretty much you can have, even it's also very related to sadness, which I see my daughter kind of have a sense of sadness sometimes, where also weight gain is a part of that, and that's what my daughter's dealing with right now. She's doing a really good job of focusing on weight loss because she doesn't want to get to a point where she's extremely uncomfortable and just can't go day to day. You know, she's kind of depressed about that, but I told her she'll get there. You know what I'm saying? It's just, you just got to set those goals and put your mind straight, and she has that, and I see it all the time with her. Trust me, if someone that goes through 8 years of dialysis and doesn't give up on the fact that she's going to get a kidney, I mean, she can get through anything. She's got that. So with I just recently went to see a surgeon, so he sent me to get an MRI. Now I had to get a CMP, which is blood work, to show all of my kidney functions, make sure that I look good as far as like my kidneys, okay? Because I donated my kidney back in 2012 to my daughter, so I only have one kidney. So when you have an MRI with contrast, you got to be very aware of the fact that they need to make sure that your kidney is doing good before you go and get that MRI done. So please make sure you do that. Make sure your kidney function is okay in order to go ahead and do contrast MRI. So right now what we're focusing on is getting a uterine artery embolization done. Okay, so this is a little different procedure. I had to do a little bit of research with this one because okay, so for the uterine artery embolization, or the UAE, it's actually a very simple, minimally invasive procedure. So it just treats uterine fibroids, for example. It blocks the blood supply to the actual uterus. So it's just like a little injection. It's a little bit of a local anesthesia. You set it, they make like a small injection, or a small like little incision, a small incision in the groin area, and then they go in there, insert a catheter. They insert the catheter into the femoral artery. They inject the contrast dye, and then pretty much helps them kind of see where they're going with an x-ray. Then they use the x-ray to guide them with the catheter. They use it to guide them through the uterine arteries. Small injection particles into it, usually made of plastic or gelatin, into the blood vessels to block the blood flow. Then they remove the catheter. The procedure takes about an hour and a half. It's actually not too difficult. Most of us are on our backs for about 6 hours, avoid any strenuous activities for 48 hours. It usually relieves the symptoms from most patients, 85 to 90%. So it's pretty high success rate when it comes to the procedure. So it's something that I'm looking to do. I'm waiting to, as long as I'm approved after the MRI is completed, then it's definitely something that I'm looking to schedule in the near future. So again, it's something that I'm just trying to avoid the hysterectomy if possible. Fortunately for my daughter, that wasn't an option. She needed to get the hysterectomy done in order to stop the excessive bleeding immediately. So again, I'm not trying to be too too visual, but it is something that we're dealing with, and as women, it's something that we deal with on a consistent basis, right? Especially for her being a kidney patient, it's so important for her to be able to relieve any type of issues occurring, to make sure that it takes any pressure off of her kidney. It's so important because we've been through so much just to get this kidney transplant for her, and it's been a successful kidney transplant. She's been doing really well, so I'm really excited about the whole process itself. Okay. All right, so thank you guys for listening in. I will keep you abreast as to my journey, as to where I'm at, let you know whether or not I get approved, which I'm excited about, hopefully soon, to help me out because it relieves some of my symptoms right now. So thank you again for listening in. If you have any questions or anything, please feel free to hit the comment section, and don't forget to hit the like button to help me with the algorithm gods. Please don't forget to subscribe to my channel, hit the little bell so you can be notified on all of my latest videos. And again, thank you so much for joining, and I hope you are all having an amazing day. And please don't forget to focus through and evolve. And please don't forget to focus through and evolve. Ciao.